Hello and welcome. Let's start today by talking about blood vessels. So here, when we go through and we talk blood vessels, the second component in relation to our in relation to our cardiovascular system. So here, when we go through and we talk then cardiovascular system, we've got blood vessels. Now, when we talk about blood vessels, I want you to know we have three major types of blood vessels. And when we talk about the three major types of blood vessels, the three major types of blood vessels will include the arteries, it will include your capillaries, and it will include veins. Arteries, capillaries, and veins. Now, when we go through and we talk about these arteries, capillaries, and veins, we'll look at each of them in greater detail. So here, first, let me talk to you about the pathway of blood. Now, when blood leaves the heart, blood is going to leave the ventricles, and blood is going to, again, you could be talking right side or you could be talking left side. Okay? If you're talking right side of the heart, artery, right? And yada yada, you saw that whole pathway to the lungs. And then now, when we go through and we talk, then the left side, same thing we have in the left side, the artery there is the aorta. So when we go through and we talk, then pathway of blood, blood leaves the ventricles and it flows into large arteries. I don't care if you're talking about the right side or left side, like I said. And then it moves into successively smaller arteries, reaching the smallest branches. You can see here as well. So it flows into arteries, right? Large arteries, and then into successively smaller arteries, eventually reaching the smallest branches, the arterioles. The arterioles, you can see, are going to feed into the capillaries. They feed into the capillary beds, as we can see here, of our body's tissues and organs. And then blood is going to drain from those capillaries into venules. Into venules, the smallest veins, and then into successively larger and larger veins. Because when we talked about veins, we said that veins are going to merge, and when they converge and merge, they form even larger veins, eventually emptying into the heart. Now, the blood vessels in adults stretch for miles and miles, thousands of miles, through the inside of our bodies. Now, when we go through and we talk arteries, I want you to think of arteries as blood vessels that are responsible for carrying blood away from the heart. And when you talk about veins, veins are going to be blood vessels that carry blood towards the heart. And arteries, we said, so carry blood away from the heart. And arteries, we said, are going to branch, diverge, and fork. When we talk veins, they carry blood towards the heart, and they converge, merge, and join to give rise to bigger veins. Opposite of what we're seeing with the arteries. So we've gone through and we've talked about our circulation, and we've talked about systemic circulation and pulmonary circulation. So you have that there on your handout. Make sure you understand that there very well again. Now let's move through and let's talk about the layers of our vessel's walls. Here we have a nice picture basically where we could see everything in greater detail compared to kind of what we could see here, same thing being depicted here as well. Here they actually get specific and get into large veins, medium veins, and then you can see here venules, and then arterioles, medium-sized arteries, and large conducting arteries. Basically, we'll go through each of these arteries and veins as well. So here, let's go through the layers of the vessel's walls. All blood vessels, except the very smallest, have three layers, or we can say tunics, surrounding a central lumen. So this is all when we talk about the structure of a blood vessel. First layer here that you need to know about is the Tunica Intima. The Tunica Intima is the innermost tunic. The Tunica Intima is an intimate contact you can think of. It's an intimate contact with the blood in the lumen. When we talk Tunica Intima is going to contain the endothelium. And the Tunica Intima is going to be the thinnest layer. So let's go through and you can see here the Tunica Intima in relation to the arteries. And then here we're going to be able to appreciate the Tunica Intima in relation to our veins. Because when we talk capillaries, we'll see their structure is different compared to that of arteries and veins. And next in here we can talk about the endothelium. Endothelium, by now I'm sure you're all experts on endothelium, right? Simple squamous epithelium lines the lumen of all our vessels, and it's continuous with the endocardial lining of the heart. Beneath that endothelium, we can appreciate the subendothelial layer. The subendothelial layer is going to be found in vessels. It's going to be found in vessels larger than 1 millimeter in diameter. The subendothelial layer, it consists of a basement membrane and loose connective tissue that's there to support the endothelium. Next, then we have the tunica media. The tunica media. Now, when we talk about the tunica media is the middle tunic. It's the middle tunic. It's mostly circularly arranged smooth muscle cells. So mostly circular arranged smooth muscle cells. And sheets of elastin. Smooth muscle activity is regulated by sympathetic vasomotor nerve fibers of the autonomic nervous system. So the muscular layer here, the smooth muscle activity, is regulated by sympathetic vasomotor nerve fibers of the autonomic nervous system and by chemicals. And this layer is the bulkiest layer of all the layers. So here you could appreciate that, especially in the arteries. And then the same thing here you can appreciate here in relation to the muscles, in relation to the veins, the muscle. Next, then we have the internal and external elastic laminae. The external and the internal elastic laminae are found in muscular arteries only. And when we go through and we talk about the internal and external elastic laminae, they're going to be thin layers of subendothelial connective tissue. Subendothelial connective tissue that's interlaced with a number of circularly arranged elastic bands. The internal and external elastic laminae are found on each side, you can see, of the muscular layer, found on each side of the tunica media, and they have an appearance of Swiss cheese, so Swiss cheese-like appearance. Next, then we have the tunica externa. When we talk about the tunica externa is the outermost layer of a blood vessel. The outermost layer of the blood vessel. And the tunica externa is composed largely of loosely woven collagen fibers that protect, reinforce, and anchor it. The tunica externa is infiltrated with nerve fibers, lymphatic vessels, and in larger veins, a network of elastin fibers. Also found in relation to the tunica externa is vasa or vasa vasorum. Vasa vasorum is a system of tiny blood vessels in the large vessels. You can think of the vasa vasorum as the vessels of the vessels. The vessels of the vessels. Now, when we go through and we talk about the vasa vasorum is going to be important because the vasa vasorum is going to have an important job, and its job is to nourish the external tissues of the blood vessels walls. I thought I had a picture of vasa vasorum, but so it'd be basically found just like we're seeing here, vessels of the blood vessels, and infiltrating basically this layer and providing all of that layer there with nutrients, because the innermost layers are going to receive nutrients from the lumen. It's making sure we get it out here. And in humans, they say we don't have vasa vasorum beneath the renal arteries, and so that's why we are predisposed to having basically triple A's, abdominal aortic aneurysms. Let's go through and let's talk about now the arterial system in greater detail. Now, when we go through and we talk about the arterial system in greater detail, the arterial system, I'd like you to know, is divided into three groups. It's divided into three groups. Now, when we talk about it being divided into three groups, here we'll see it's going to be made up of elastic arteries, muscular arteries, and then arterioles, as we can see there. Now, when we talk elastic arteries are also known as conducting arteries, and they are going to contain a lot more elastin in relation to them. They will also contain a substantial amount of smooth muscle, but they are relatively inactive in vasoconstriction. The function of the elastic arteries, their function is to conduct blood. It's to conduct blood and conduct blood from the heart to your medium-sized arteries. Now let's talk a little bit about the structure of these elastic arteries. These elastic arteries are thick-walled arteries. They are thick-walled arteries. They are found near the heart. They are going to have the largest diameter, so largest in diameter. So largest in diameter range, the diameter is going to range anywhere from 2.5 centimeters down to about 1 centimeter. You'll see different numbers in different areas, but we'll stick to these to keep it simple. Next, then we have our muscular arteries. Now, the muscular arteries are going to be the part after the elastic arteries, right? Because we said these vessels, they continue to divide and branch as they make their way deeper into the body. So the elastic arteries, and then you have your muscular arteries. So muscular arteries are the part after the elastic. The muscular arteries, they are also known as the distributing arteries. Because they're going to be responsible for distributing blood. They will distribute blood basically then to all of the organs and tissues we're going to go through and we're going to be seeing and we're going to be checking out. Next, then we have, after our muscular arteries, their function. So when we talk function, it's to deliver blood to specific body organs, and they're going to account, you'll see, for most of the named arteries. So their function is to deliver blood to specific body organs, and we'll see they're going to account for most of the named arteries that we're going to have to go through and we're going to learn about. Now, when we talk about the structure of the muscular arteries, you'll see their internal diameter ranges from that of a little finger, so from about 1 centimeter, to that of pencil lead, about 0.3 millimeters, down to about 0.3 millimeters. They have the thickest tunica media. They have the thickest tunica media, and they will contain more smooth muscle than elastic and less elastic tissue. These arteries are more active in vasoconstriction. More active in vasoconstriction. So when we talk arterioles, arterioles then are the smallest of the arteries. They're going to be the smallest of the arteries. So here we can appreciate the arterioles. Smallest of the arteries. Their function is going to be to determine blood flow into capillary beds. To determine blood flow into capillary beds. They're going to respond, we'll see arterioles will respond to neural, hormonal, and local chemical influences. When we talk about the structure of arteries, they have a lumen diameter that will range from about 0.3 millimeters down to about 10 micrometers, so very small. Next, then, this takes us into capillaries. When we talk about capillaries, capillaries are microscopic. They are the smallest blood vessels that we have. Their function is that they act as back alleys and driveways. They're going to act as back alleys and driveways that are going to provide direct access to every cell in the body. Capillaries also play a role in exchange of materials between blood and interstitial fluid, like gases, nutrients, hormones, and so forth. Now, when we talk about the structure of capillaries, they have very thin walls. They're going to consist of just a thin tunica intima. They're going to consist of just a thin tunica intima. You can see that here, the endothelial cells, and then there's basement membrane providing support. So here when we look at it in greater detail, you can see they also have pericytes. They also have these pericytes, which are spider-shaped smooth muscle cells. Spider-shaped smooth muscle-like cells. And they're going to be found in the outer surface. And what they do is they stabilize the capillaries wall, and they help control the capillaries permeability. So that's the structure of a capillary. Now, when we go through and we talk about our capillaries, now in greater detail, here we can appreciate our capillary beds. Our capillary beds. Now, when we talk about our capillary beds, these capillary beds are going to be interweaving networks that carry blood flow from an arteriole to a venule. We also refer to these capillary beds as our microcirculation. These capillary beds are going to consist of two vessels. One we can see is the vascular shunt. We see right inside of here. The vascular shunt is highlighted only here, you can see. It consists of the meta-arterial and thoroughfare channel. The second set of vessels basically will be your true capillaries. All these true capillaries you have here on the outside. So that's what a capillary bed consists of. Now let's talk first the terminal arteriole. We can see here the terminal arteriole. The terminal arteriole feeds the capillary bed, as we could see. Then we have a post-capillary venule. The post-capillary venules basically are going to now be responsible. So here we've got the post-capillary venule. Post-capillary venule is going to be responsible for now draining the capillary bed. Drains the capillary bed. Here, terminal arteriole feeds the capillary bed. And here we're going to see post-capillary venule will drain the capillary bed. Now between the two, we have true capillaries. The true capillaries that we can see here, we can have anywhere from 10 to 100 per capillary bed, and that'll be all dependent on the organs and tissues themselves. These true capillaries are going to branch off of the meta-arterial. They're going to branch off of the meta-arterial, and they return to the thoroughfare channel. These true capillaries are the actual exchange vessels. These are the actual exchange vessels. Here we can also appreciate the pre-capillary sphincters. Now these pre-capillary sphincters we can appreciate here are going to be cuffs of smooth muscle fibers which are found surrounding the root of each true capillary. They're found surrounding the root of each true capillary at the meta-arterial. We can see that there very nicely. And they're going to act as valves. They're going to act as valves to regulate blood flow into the capillaries. So they have the ability to snap basically closed there. And if they snap closed, blood isn't going to make its way into the true capillaries, so it's not going to be involved in exchange. That blood then is going to be rerouted right back into circulation. Maybe there's something that activated some other system somewhere else and that needs now blood. So this blood will start getting rerouted by these precapillary sphincters starting to shut and routing that blood then right through here and back into the circulation, helping it to go wherever it may be needed. So those are the true capillaries. So now here let's talk our vascular shunt. Let's talk about the meta-arterial and thoroughfare channels. This is a short vessel. Now, whenever we use the word shunt, whenever you hear that word shunt, you have to remember you have a mixing of arterial and venous blood happening there. So here, this vascular shunt that we have is a very short vessel. It directly connects the arterial and the venule at opposite ends of the beds. It's a continuous vessel, as we can see there. First, we have the meta-arterial. The meta-arterial is a blood vessel that's structurally found in between this terminal arterial, the true capillaries, and the thoroughfare channel. Now, when we talk about the thoroughfare channel is the blood vessel that's going to be found intermediate the true capillaries, the meta-arterial, so intermediate, the capillaries, okay, the meta-arterial, and then here the post-capillary venule. So it's in between those. And again, that terminal arterial right on one end of the meta-arterial. And then here you also have basically this thoroughfare channel and then the true capillaries. So the meta-arterial in between, terminal arterial, true capillaries, right? And the thoroughfare channel. When we talk thoroughfare channel, in between, meta-arterial, true capillaries, right? And then the post-capillary venule we can see here. So let's move then from capillaries over to venous system. Let's move back to the venous system. A nice picture of the artery and vein under the microscope. We'd have this in lab, and you can check that out basically for lab and have that understanding there. Now we talk veins. So we talk veins, the venous system. Venous system is responsible for carrying blood from the capillary beds towards the heart. Carries blood from the capillary beds towards the heart. First, we have our venules. Our venules, their function, you'll see they're extremely porous vessels. Okay? They're extremely porous vessels, so fluid and white blood cells move easily from the bloodstream through their walls. Their structure, anywhere from 8 to about 100 micrometers in diameter. And they are formed when the capillaries unite. Smallest venules consist of endothelium around which parasites congregate. Larger venules will have one or two layers, and then you'll see when we talk larger venules, they'll have one or two layers of smooth muscle cells and a thin tunica externa. So when we talk about the structure of venules, they're going to vary. The smaller venules are going to consist of endothelium around which parasites congregate. The larger venules are going to have one or two layers of muscle cells and a thin externa. Now, when we go through and we talk about veins, veins are going to be basically formed when venules join. So venules will join to form veins. Now, the function of veins, we'll see they're referred to as our capacitance vessels, and they're going to be basically our blood reservoirs. And our blood reservoirs, the reason why is because they contain up to 65% of the body's blood supply. Now, when we talk about the structure of veins, they'll have three distinct tunics, but their walls are always thinner and their lumens larger than arteries. Little smooth muscle or elastin in the tunica media. The tunica externa consists of thick longitudinal bundles of collagen fibers and elastic networks. We will also find valves. And you can see the valves are going to be found more in these medium-sized veins we can see here, which are going to be found really in the limbs we'll see. Now, when we go through, we talk about venous valves. Venous valves, they're going to be formed by folds of the tunica intima, and they resemble semilunar valves in structure and function. Again, they're more abundant in limbs where flow is going to be opposed by gravity. Now, when we talk about blood flow through the arteries is going to happen thanks to the pulsatile effect of the arteries from the heart when the heart contracts and it dumps the blood off onto the arteries. Now, that pressure starts to dissipate. It starts to go down by the time you reach the capillaries, and it's basically really low when you get into the veins. So then how is blood moving in veins? Well, there's three ways blood is moved through veins. We'll see number one, they have valves. These valves are going to ensure that blood flow is moving in just one direction. Second, we'll see we have pumps, basically. Respiratory pumps, and these pressure changes that will take place in these cavities, thanks to just inspiration and expiration, will kind of push up against these major veins and help blood to move forward. Third, then, we have the distribution of our veins. Our veins, when they're distributed, we'll see they're going to be found placed in between muscles. And when they're found placed in between muscles, as we see here we have then our skeletal muscle pumps. Now, these skeletal muscle pumps now are going to do exactly what the name says. When the muscle contracts, what this does, it pumps that blood forward. One perfect example we're going to see is going to be this vein that's going to be running in between our pec muscle and we're going to see our deltoid muscle. So let's go through then and let's talk about major blood vessels of the body. Now, before we jump into that, again, review pulmonary circuit, systemic circuit that we've gone through and we've talked about and we've checked out. So make sure you got those understood. Next, then, let's talk major veins of the body. So let's get into the major veins of the body. Here we can see the systemic arteries. Here we can appreciate the systemic veins. What we'll do is we'll go through all the veins, get these veins taken care of, and then we'll jump into the arteries and get the arteries taken care of. And then we'll move into blood, and then we've got lymphatics left, and we'll get all this taken care of. So here when we get into the major veins of the systemic circuit. Major veins we have here, we'll start off with first the superior vena cava. The superior vena cava, it receives systemic blood that's draining from all areas superior to the diaphragm, except the heart wall, right? We've talked about. The superior vena cava is going to be formed by the union of the right and the left brachiocephalic veins. So when the right and the left brachiocephalic veins come together, as we can see here, they form the one vein, the superior vena cava. Then the superior vena cava, we saw, empties into the right atrium. Let's talk brachiocephalic veins. So let's move, right? We've taken care of all of this. So here, nice simplified image of basically what we're talking about. So here you've got the superior vena cava. It's formed by the two brachiocephalic veins. Now the two brachiocephalic veins you can see there, okay? And again, you can see the same thing here. They're very small in structure. Here, they're just giving us a good idea by enlarging them there. So here you could see right and left brachiocephalic veins. And they both come together to give rise to that one superior vena cava. Remember we said the veins converge and merge. So you see that there. Now when we talk brachiocephalic veins, two of them. We have two of them. Each is formed by the joining, by the union of the internal jugular vein and the subclavian veins. So when the internal, you can see this on the right side, so when the internal jugular vein and you can see the right subclavian veins come together, they give rise to the brachiocephalic vein here on the right side we're seeing. See the same thing happening here on the left side. Now then we talk internal jugular veins. Internal jugular veins found as a pair, and they are going to receive the bulk. They will receive the bulk of blood that's going to be draining from the brain. Subclavian veins. Subclavian veins, right and the left, you have, right and left. Now the right and the left subclavian veins are going to become basically the subclavian veins after the first rib. So coming back in here, we can see here now on both sides, same thing, the right and the left. So right brachiocephalic vein formed by the internal jugular on the right side and the right subclavian. Now this right subclavian is the subclavian from the first rib. The first rib is going to be about right in here. So from the first rib up, subclavian, right underneath the clavicle. And then here you can see that's where then the jugular comes into it. Right, still under the clavicle, it's all under the clavicle. So right about here, where the first rib is at, is where it becomes a subclavian, because before that, look at here how many other vessels we have. We're going to be able to see here, cephalic vein, here on the outside. And then we're going to see here, we've got then our axillary vein. So the axillary and the cephalic come together, and when they come together, you can see that's where the subclavian is formed, and that's going to happen at the first rib. So it's going to run, subclavian is going to run from that first rib up to where it joins with that internal jugular. Inferior vena cava, then let's check out when we talk inferior vena cava. The inferior vena cava returns blood to the heart from all body regions below the diaphragm. From all body regions below the diaphragm. The two vessels that come together to give rise to this inferior vena cava are the common iliac veins. So the common iliac veins form the inferior vena cava at around L5. They drain, the common iliac veins drain the lower limbs. You could see here they drain the pelvis and lower limb. Let's talk then. So we can see here what we did is we took care of the torso kind of there. Main parts of that torso you could think of. Let's jump into now the head area and the brain, and then we'll jump into the upper limb, and then we'll jump down here to the lower limbs, and we've got the body, and then the abs, and basically the chest area, and we've got everything taken care of. So here then let's talk about veins of the brain. So here we can see a nice simplified view here, and we can look at basically this view here. It's not totally depicting everything we need to see, but here you can see now that first rib we mentioned, okay, and here you have the subclavian vein. And the two come together with, so the subclavian and the internal jugular to give rise to that brachiocephalic. And the two brachiocephalics are coming together to give rise then to the superior vena cava as we see here. So now when we talk veins of the brain we're going to be able to appreciate here. Veins of the brain, we have first superior and inferior sagittal sinuses. The superior and inferior sagittal sinuses are going to be found in the falx cerebri. The inferior sagittal sinus, you can see here very nicely, is going to drain, you can see the deeper parts of the brain, and it will drain this blood into the straight sinus. The straight sinus will take this blood, route it to the confluence of sinuses. Here we have then the superior sagittal sinus. The superior sagittal sinus, you can see, is going to empty directly into the confluence of sinuses. So the inferior sagittal drains into the straight sinus posteriorly, and then the superior and the straight sinuses empty into the confluence of sinuses. From the confluence of sinuses, then you can see here, this blood is going to make its way into the transverse sinuses. From the transverse sinuses, this blood then is routed into the sigmoid sinuses, S-shaped, sigmoid sinuses. From the sigmoid sinuses, then blood is going to make its way down into the internal jugular veins. And then here we can see at the deepest aspect, we have our cavernous sinus, which will also empty into, then you can see, the internal, and we've got one part basically coming into the sigmoid. Next then, let's move to the veins of the head and the neck. So when we talk about veins of the head and the neck, right, we can see here, and we can see here as well. Now when we talk veins of the head and the neck, first you have your facial veins. Facial veins will drain the nose and the upper lip area. So the same thing you're seeing here, what we see here is the same thing you're going to see on the other side. So when we talk facial veins, they're going to drain the nose and the upper lip area, as we can see. We have our occipital veins. The occipital veins, you can see now, are going to be found draining. The occipital vein is found draining. You can see the posterior scalp region. Posterior scalp region. Next in here we can appreciate the external jugular veins. Or we can appreciate one of them here, but then we'll have the same thing on the other side. So here you can see that occipital empties right into that external jugular vein. And then here we can see the facial has got basically one part that empties into our internal jugular. And then you can see here we've got some branches that are going to be making their way into that external jugular from the back. Ophthalmic, right, taking care of the orbital cavity bilaterally. And then here you can see the external jugular is going to join the subclavian before the subclavian joins with the internal jugular. Also, here we have our vertebral vein. It's running through this structure here. And you should know the name of that structure there that it's passing through as well. Next, let's move to the veins of the thorax. Let's talk about veins of the... I'm sorry, before we jump down there, we got our superficial temporal as well. The superficial temporal vein, you can see, making sure it drains the superior and kind of anterior aspects of that cranium and the scalp. Superficial cranium and the scalp. Next in here, let's move to the veins of the thorax. Now, when we talk about the veins of the thorax, now here we can appreciate first the azygos vein. The azygos vein is located against the right side of the vertebral column. It's one of my favorite veins to dissect out. It's located against the right side of the vertebral column. It originates in the abdomen. It originates in the abdomen from the right ascending lumbar vein. From the right ascending lumbar vein. Now, next up we have our intercostal veins. You can appreciate the azygos here. And the intercostal veins you can appreciate here very nicely. Intercostal is doing exactly what the name says. Again, you should know the name of the structure that they're passing through in the ribs. Same thing with the artery, same thing with the nerve. Right? We've talked about that with the nerves. Next in here we're going to see we've got veins of the upper limb. Let's talk about veins of the upper limb then. When we talk about the veins of the upper limb, first we'll start with the radial and ulnar veins. They are deep veins of the forearm. The radial, you can see, and ulnar. Deep veins of the forearm. And they unite to form the brachial vein. They unite to form the brachial vein. So deep structures of the forearm are drained thanks to radial veins and the ulnar vein. When we talk deep structures of the, basically that you can see that upper limb then, we've got our, we said brachial vein. Next in here we're going to see we've got our cephalic and basilic veins. So the brachial vein, vein of the arm, right, becomes the axillary vein as it enters the axilla. And we'll check all that out right now. So cephalic, you can see here, cephalic is draining the lateral aspect of the forearm and the arm. And here it's going to run in right in between those two muscles I mentioned to you. So travels superiorly up the radius and lateral superficial aspect of the arm to the shoulder, where it runs in the groove between the deltoid and pectoralis muscle to join the axillary vein, as we see here. To join then that axillary vein. Now we talk basilic vein. Basilic vein, here you can see on the posterior medial aspect of the forearm. It crosses the elbow and goes deep and joins the brachial vein. Joins the brachial vein in the axilla, forming the axillary vein. Forming the axillary vein. Here then we can see the median cubital vein. The median cubital vein is connecting the basilic and cephalic veins. This vein is the vein that's used more commonly in venipunctures. Used more commonly in venipunctures. Then the axillary veins will be responsible for draining the axilla. They will be responsible for draining the axilla. The axillary veins are formed by the brachial and the basilic veins. Formed by the brachial and basilic veins. The axillary vein is going to become the subclavian at the level of the first rib. Becomes subclavian at the level of the first rib as we described. Next then we have the veins of the abdomen. When we talk about the veins of the abdomen, here we're able to appreciate now the suprarenal veins, and they drain exactly what their name says, the right drains the adrenal on the right and empties into the inferior vena cava, as we see. The left drains into the renal vein, which will then direct blood flow into the inferior vena cava. The renal veins will drain the respective kidneys. Right kidney, left kidney, directly into the inferior vena cava. Gonadal. So if we're talking testicular or we're talking ovarian, wherever we're at and whichever respective sex we're talking, generically speaking or generally speaking, gonadal veins. Now we talk right gonadal, the right gonadal is going to drain the right testy or ovary directly into the inferior vena cava. The left gonadal will drain the left gonad and drain that gonad into the renal, into the left renal vein. And the left renal is going to route that blood into the inferior vena cava, as we see. Hepatic portal system, then let's talk about next. Now, when we talk about the hepatic portal system, my favorite system, it's a series of vessels in which two separate capillary beds are found lying between the arterial supply and the final venous drainage, where we've seen it's just one normally. So here we have first your hepatic portal vein. This hepatic portal vein is a short vessel, and it actually connects the first capillary bed structure to the second capillary bed structure. So it connects the first and second capillary beds. Now, this hepatic portal vein is going to be formed from the superior mesenteric vein, and we can see this splenic vein. So first we talk superior mesenteric vein. This superior mesenteric vein we can appreciate here. It's going to drain the stomach, the entire small intestine, part of the large intestine. Which parts? The ascending and 3/4 of the transverse. So here you can see your hepatic portal formed by this superior mesenteric and splenic veins. So here you can see now, it's the superior mesenteric vein is what we're talking about, drains the stomach. It's going to drain the entire small intestine. And then you can see here the large intestine, the ascending, and about 3/4 of the transverse. Because then the last quarter is going to be taken care of thanks to the inferior mesenteric vein. We'll talk about that in a few seconds. Splenic vein next. Splenic vein is going to collect blood from the spleen, part of the stomach, and the pancreas. And then it joins the superior mesenteric vein to form, you can see, the hepatic portal vein. Now the inferior mesenteric vein, it drains the distal portions of the large intestine and the rectum. And it joins the splenic vein just before the vessel unites with the superior mesenteric vein to form the hepatic portal vein. So the hepatic portal vein is like the gate. It's basically the entrance to the gatekeeper. Right? We discussed the liver as being the gatekeeper. So this is how the nutrient-rich blood makes its way to that liver. It was a mystery up until now. And their mystery is resolved. Hepatic veins we have next. Hepatic veins, you can see up here, we have right and left hepatic veins, middle hepatic veins. And what they're going to do is they're going to carry venous blood. They carry venous blood from the liver. Now, after the liver's processed it and done whatever it needs to do, they'll carry this blood from the liver to the inferior vena cava, as you see here. To the inferior vena cava. And then you have all these other veins here as well. You can go through and you can check out gastric veins. I want you to go through the gastric veins and understand how they're responsible for draining the stomach and which part of the stomach. And then here you can see your gastroepiploic veins. Greater curvature, lesser curvature. Okay, and then we also have here. I want you to go through and check out ileocolic veins. You're going to have in the ileocolic region. Okay, so just get those few veins checked out there as well. Next, then let's move down to the veins of the pelvis. When we talk about the veins of the pelvis, so here we're going to be able to appreciate first the internal iliac veins. Now, the internal iliac veins, so we can see same thing here, same thing here. The internal iliac veins are going to be responsible for draining the deep pelvis. The internal iliac veins will join the external iliac veins to form the common iliac veins. So you can see here the internal and the external coming together to give rise to the common. And the two commons we said come together to give rise to the inferior vena cava. So then we have the external iliac veins. So the external you can see are going to be responsible for draining the lower limbs mostly. Now the externals are formed by the femoral vein we're going to see in a few seconds. And that external is going to join the internal to form the common iliac. So here then let's look at the veins of the lower limb then. Let's start with the fibular veins. So here we can appreciate the fibular vein, right back there. Let's actually turn the leg around. So here you can see the fibular vein. Fibular vein is also known as the peroneal vein, aka peroneal vein. It's a branch of the popliteal vein. It's a branch of the popliteal vein. Or you can say it helps to come together with other veins to give rise to the popliteal vein. So next then we have the anterior and posterior tibial veins. So here the fibula is going to drain the deep, you can see, and basically the lateral aspect of the leg. Anterior tibial vein, you can see, is going to make its way towards the anterior aspect of the leg. And here we got the anterior tibial. The anterior tibial then, you can see, is going to be formed by the dorsalis pedis. It's the superior continuation of the dorsalis pedis vein. And then the anterior will drain the deep anterior structures of the leg. The posterior tibial. Posterior tibial ascends deep in the calf muscles. So posterior tibial, it ascends deep in the calf muscles, and then you can see it receives the fibular vein. And it will drain the medial aspects of the leg. So the lateral aspect of the leg, we had fibular vein. Medial aspect of the leg, you can see posterior tibial, and then anterior tibial for the anterior. And then you can see how basically all these veins come together to give rise to the one popliteal. Popliteal vein formed by anterior, posterior, right, the main two, and it courses in the back of the knee. Courses in the back of the knee. Femoral veins, we can appreciate here. They drain the deep structures of the thigh. We have then great saphenous vein. The great saphenous vein we see here is a very superficial vein. It's a very superficial vein. It's the longest vein of the body. You can see here it travels superiorly along the medial aspect of the leg to the thigh. And it empties into the femoral vein distal to the inguinal ligament. Distal to that inguinal ligament. All right, got it all.